Hello everyone, I am Gladime Polisico, a student nurse from Visayas State University. So for today's video, we're gonna talk about urinary calculi or kidney stones. Urinary calculi or kidney stones have many names, including urolithiasis, which are the formation of stones along the urinary tract, and nephrolithiasis, which is stone formation in the nephron or kidneys. What are kidney stones? It refers to stones or calculi in the urinary tract and kidney respectively. They are hard, insoluble, crystallized minerals and salts that have formed out of the filtrate produced by the nephron. Let us review first the anatomy of the urinary tract.
In order to understand kidney stones, we have to revise the anatomy. Here, the adrenal glands, which are endocrine glands, sit above the kidneys. The kidneys form urine. Urine will then travel down the ureter and be stored in the bladder. The bladder can stretch, and once full, we urinate. The urine will flow through the urethra and then out. The ureter has three sites of constriction, where it contracts the smooth muscle. And these are important to know because these are the sites where narrowing can occur, and also the site where urinary stones can lodge. The sites of ureteric constriction include the pelvic ureteric junction, the pelvic brim, and the vesico-ureteric junction. The vesico-ureteric junction is actually the connection between the ureter and the urinary bladder, which is sort of behind and under the urinary bladder. The kidney is the organ responsible for filtering the blood and disposing of waste. It's important for regulating blood pressure and regulating electrolyte balance. It is also responsible for producing some important hormones such as erythropoietin and activation of vitamin D. Here is the adrenal glands, which are again the endocrine glands that sit above our kidneys. Here is the ureter. Looking inside the kidney, it consists of pyramids called the medulla pyramids. Surrounding the medulla pyramids is the cortex. The medulla pyramids joins. The tip of the medulla pyramids joins and forms the calyx. The calyx then join together and form and drain into the renal pelvis. The renal pelvis has a renal artery and renal vein entering and exiting it. Residing around and within the medullary pyramids are the functional units of the kidneys called nephrons. Nephrons are structures which filter our blood. They secrete waste and allow reabsorption of things into the bloodstream. Thus, it has a main role in regulating electrolyte and fluid balance in our body. The head of the nephron is the Bowman's capsule, where the afferent arteriole brings blood in, forming the glomerulus, and then we have the efferent arteriole leaving the glomerulus. Once filtering has occurred within the Bowman's capsule, the filtrate will travel along the tubule of the nephron. Firstly, it will pass the proximal convoluted tubules, then it will go down towards the loop of Henle, the distal convoluted tubules, and then finally the collecting duct. Looking more closely at the tubule, the cells that line the nephron tubules are predominantly cuboidal epithelial cells. Within the tubule of the nephrons, crystal-like structures can form. The crystal-like structures are essentially precipitants of some electrolytes that have accumulated there. This crystal is actually a urinary stone. If the crystal is small, it will just pass in the urine. But if it remains in the kidneys, in the nephron, it can grow bigger and become a kidney stone. A kidney stone, again, is basically a big crystal. The kidney stone can lead to an obstruction. The obstruction within the tubule can create a buildup of pressure in the tubule. This pressure can cause irritation, and this irritation is read by the brain as renal colic. There's also an inflammatory process going on due to the obstruction, and this also leads to the renal colic, the pain we feel when there is urinary stones in the body. Alternatively, the urinary stone can lodge or get stuck within the ureter. Remember the sites of constriction of the ureter? Well, the stones can get stuck there, and when this happens, irritation and pain can occur due to stretching of the fibers that are there, which are caused again by the increase in pressure within the ureter. With this increase in pressure proximally to the site of obstruction, and with the irritation going on, edema can occur, and the ureter will contract more vigorously, trying to push the stone out. This is called hyperperistalsis.
Potential sites of calculi formation could either be in kidneys, ureters, or in the bladder. Risk factors of calculi formation may include high protein diet, high salt intake, obesity, dehydrations, medications such as antacids, carbonic anhydrase inhibitors, and sodium and calcium containing medications. Clinical manifestations. Signs and symptoms of stones in the urinary system depend on the presence of obstruction, infection, and edema. It may include acute flank pain, associated fever because of inflammation, nausea and vomiting, urinary frequency or urgency, and hematuria. Assessment and diagnostic findings. Dietary and medication histories and family history of kidney stones are obtained to identify factors predisposing the patient to the formation of stones. Non-contrast CT scan, blood chemistries, and a 24-hour urine test for measurement of calcium, uric acid, creatinine, sodium, pH, and total volume. Chemical analysis. It is carried out to determine their composition. Lastly, stone analysis. It can provide a clear indication of the underlying disorder. Medical management. The goals of management are to eradicate the stone, determine the stone type, prevent nephron destruction, control infection, and relieve any obstruction that may be present. Under pharmacologic therapy are the opioid analgesic agents. These are given to prevent shock and syncope that may result from the excruciating pain. Non-steroidal anti-inflammatory drugs is another one. They are effective in treating kidney stone pain because they provide specific pain relief. Under non-pharmacologic therapy are hot baths or moist heat to the flank area and fluid intake encouragement. Nutritional therapy plays an important role in preventing kidney stones. Here are some of the instructions the nurse must instruct the patient in order to prevent kidney stones. Interventional procedures. If the stone does not pass spontaneously, or if complications occur, Common interventions may include ureteroscopy. It involves first visualizing the stone and then destroying it. Access to the stone is accomplished by inserting a ureteroscope into the ureter and then inserting a laser, electrohydraulic lithotriptor, or ultrasound device through the ureteroscope to fragment and remove the stones. Extracorporeal shock wave lithotripsy, or ESWL, a non-invasive procedure used to break up stones in the calyx of the kidney. Lastly, endourologic stone removal may also be used to extract kidney calculi that cannot be removed by other procedures. Surgical management. Surgical intervention is indicated if the stone does not respond to other forms of treatment. It may also be performed to correct the anatomic abnormalities within the kidney to improve urinary drainage. It may include nephrolithotomy if the stone is in the kidney, nephrectomy if the kidney is non-functional secondary to infection, pylorolithotomy if the stones is in the kidney pelvis, ureterolithotomy if those in the ureter, and lastly, cystotomy if the stone is in the bladder. Nursing diagnosis may include acute pain related to inflammation, obstruction, and abrasion of the urinary tract. Deficient knowledge regarding prevention of recurrence of kidney stones. Nursing interventions. Relieving pain. Opioid analgesic agents may be prescribed and given to provide rapid relief along with an IV NSAID. The patient is encouraged and assisted to assume a position of comfort. The pain level is monitored closely, and an increase in severity is reported promptly to the primary provider so that relief can be provided and additional treatment initiated. Prognosis. The prognosis is good if urinary tract obstruction is prevented. That's it for urinary calculi. Thank you for listening and may God bless you all.